I'll try to summarize very briefly on not all the outcomes, but I guess the main points that were raised during the discussion. Basically, I think the most important point is to say that we are talking about people and how to attract them to a rural area. So there needs to be the conditions for them to feel realized and that their life is completed in this area. So not only the professional career, that they have the right infrastructure, access to good to opportunities and so on, but also that the conditions in the rural area goes hand in hand. These people have families, they have kids, they have parents, and they need to have access to all the services they need. But it is true that we focus more as well on the with kids. We said that we need to start not with kids, sorry, with young students. We need to start with them. It's the early stage. So there needs to be an approach to be the culture of being a doctor in rural areas. That this is something of prestige, and that will allow them as well to develop a positive career around that. So here we talked different approaches and recommendations. First, trying to change in a sense, or try to admit more students that come from rural areas into medical schools. It is shown that it increases the chances to bring more rural doctors to rural areas. To move as well some of the training to rural areas, so they experience the positives of practicing and studying there. And there is a lot of work around training, offering them as well training even once they become a doctor, that they still have access or proximity to academia, to science, so that they can continue building on that. The point of addressing all these issues around health, there is an aspect of social accountability. There is a moral obligation to address this issue everywhere. We discussed as well about long-term placements in rural areas. There are good examples in Australia that showed good results about this type of measures. The issue of champions came up as something really important, to find those champions around health that can mentor or motivate, inspire as well young students to follow similar career. This goes, I think, in line with as well the giving more prestige to become a rural doctor for that. So recognition of being a professional in the rural areas. We need to find ways to recognize better those things. We found models of decentralizing, in a way, teaching and training of medicine, decentralizing it more and bringing it closer to rural areas. That has been shown as well as a useful approach to that has positive results to then incentivize and motivate people doctors to move to rural areas. And lastly, we as well concluded with the point of let's say with the other leg. So we focused a lot on young doctors and training them, but also there is the part of the general rural development. We need to improve accessibility to health services, and here, for instance, digital technology could play a role in supporting telemedicine. But on the other hand, rural areas many of them are lagging a bit behind in terms of digital infrastructure in that sense. We had as well presentations from the government of Castilla-La Mancha that they have implemented a law on rural depopulation, and they have put in place or they bring together different public administrations, not only the traditional one dealing with agriculture, but all of them to really design a transversal package to support and attract doctors in rural areas. That goes with packages to settle in rural areas, so with advantages if you move to rural areas. But I think this exemplifies a good point. Like most of the recommendations, if we look at the political governance, There are responsibilities that fall within a Ministry of Education, a Ministry of Health, and most likely as well a Ministry of Regional Development and a Ministry of Rural Development. So how do we make all these actors talk together? I think the example in Castilla-La Mancha with that all brings under a specific law dealing with rural depopulation could help in coordinating and making sure that these actions are happening. I think that's hopefully in a nutshell. I'm pretty sure colleagues in the group who were extremely active could complement more, but I have to say that many of these points, I mean, everything has been captured, and we will try to report them in the report of this event.
Thank you, Enrique. Yes, we have all your contributions, inputs on the Miro board. So I'm moving to the second group on innovative ways to deliver general and specialist earth services, and I will ask Patricia to
yes,
your
thanks, Pascal. So we have a very interesting discussion there, touching about many topics, but we started with one critical remark, and that is that there has been like an increasing number of different e-health, telemedicine, mobile tools that have been created and deployed to create these innovative ways that can support the healthcare professional. But in order to make this connected, integrated, and sustainable, we need the interdepartmental cooperation. So we cannot keep relying only on one department, for instance, the health ministry, leading the effort to make this possible, because then the solution that has been developed will not be sustainable. It is highly dependent of other departments, of other actors that ensure, for instance, the access to the broadband or the access to the mobility in terms of roads, so that the people can even use these mobile units that have been created. And for this challenge, there is an existing solutions. We also mentioned Australia as some existing examples of integrated intergovernmental cooperation that has been created to work across departments so that they don't working in silos. I think also a bit what we are trying to do with the Rural Pact, so that that is cross-departmental, everybody co-designing these solutions, because otherwise they are created, but they are not sustainable, and they are not support in the way they should, because they are like lacking of other elements to make it possible. We have also spoke a lot, as it is obvious, about the digital device for a lot of groups, not only like you might think for the elderly, but for many people in the population in rural areas. Sometimes the lack of trust. There is also certain ethical issues that might be created or not might pose when we're using this kind of tools that needs to be properly tackled. And we were discussing with those that have been involved in projects how there is still the lack of legal frameworks supporting this. In the case of the European Union, for instance, we have at EU level the General Data Regulation Protection. That's an example. And in the case of Romania, for instance, our Romanian keynote speaker, Vlad, with the mobile caravans, was saying how they have to boost to have the regulatory framework created based on the work that they were doing, and really advocating for it, showing the success, showing that it was working, in order to convince some parliamentarians that it was. And even though it was still a challenge to bring public authorities to regulate this, so there is still a need to have this supportive framework, this regulation, so that the ethical issues, ethical considerations, data protection, and so on, are properly covered by law when we are deploying this. We also speak about the big diversity in rural areas that needs to be properly taken, and the users that are involved with, for instance, in the Russia project, how they are co-creating it with the different users, so those that are going to, the patients that are going to use it, but also the health workers. We said how a practical solution would be also to involve the IT developers. They need to be fully aware of what are the needs of the patient that are going to make use of it, so that we are using and delivering very user-friendly interfaces that are going to be actually useful for the patients, and then to make sure that when we are applying this rural proofing to the curriculum of the health workers, they are also aware of how to use this, but also that this means less work and not more workload, and that the use of these mobile and health services are properly integrated into their workflows. There was much more, but yes.
Okay, thank you very much for your report. And for the third group, I will ask Urszula to report on the integrated and community-based services working.
Yes, thanks a lot, Pascal. I would just very quickly show you what we have developed. We have been quite strong on a number of different types of challenges, starting from the depopulation, rural depopulation, isolation, and remote areas, challenges of getting care to the home for the elderly, and that also the issue that more attractive areas find it easier to get doctors, but less attractive areas. There was example from France, where in the south it's easier to get doctors, in the north it's not so sexy for people to work there. So that also has to be taken into account, the governance issue, but not lack of cooperation between the national and regional and the different levels of actors. The whole issue of stigmatization, that having health issues, especially mental health, especially for men or for farmers, this is like a whole huge, it's community related. It's, if you're trying to address health, you find that, yes, women would come to the meetings and so on, but men would not. So for some of the practical solutions, we found, of course, the technology-related solutions, such as applications to help overcome the stigmatization, because you connect remotely, and also different learning tools or training, capacity building tools. Also, the whole range of different organizations that can act as local anchors, that are very important. Of course, local authorities. I will come to Leaderlight later on, because that also comes in the policy recommendations, but they are also an important actor, especially the social, let's say, whole actor, social farming, and this is something that actually gives the rural areas a competitive advantage, because that exists in rural areas. It doesn't exist in urban areas. So that possibility is giving an advantage to rural areas. And then we had a number of solutions, practical solutions, like the whole city, let's say, village or the whole town taking care of its residents together, or public actors, organizations investing by local purchasing, investing money back to the community to actually afford to continue provide health services. The possibility of using agronomists or extension service workers to identify health issues, or a dedicated local company that provides care, which is proximity, is not that distant, or a befriending service, or local volunteers that are doctors and nurses that in their free time, paid by the municipality, can provide this basic contact, first contact care to the patients. I think quite a lot of interesting good practices. We were talking in terms of policy, actually, that it is this is a new topic. There are a lot of policy gaps still, but it's at least good that this is a topic that only recently emerged, but we're starting talking about it. That's already good news. And the important thing is that there are a lot of good practices, but they need to be mainstream. They need to be systematized. They need to be not just an ad hoc solution, but they need to be systematic and more mainstreamed. And we had examples of, like, the renewal of social contract, like an overarching solution. The Netherlands apparently has a very nice, must have a policy friendly policy framework to foster, for example, social care, social farming, because that seems to be much more using that opportunity than in other countries. And also the recommendation from WHO that is working with the financial sector, working with banks and central banks, because in fact the lesson is that when there's no health services, that has an impact on fiscal instability. So of course it's in the interest of everybody to work together, so there's this common grounds with different institutions. And other lessons include this whole issue of leader lags that can play an important role, and they should be in the next period actually more actively involved in health issues. They should also use the benefit of smart villages, but there's a need to encourage lags to actually make use of that the tool. And also there were two issues about the one is legal. A lot of farms, for example, they don't have a legal entity, so they cannot benefit from support. And it's also important to be proactive and to start doing something before the health services actually disappear, before the practitioners go, before the clinics close down. So that's more or less the gist of what we had in our group. But very rich discussion, and we haven't finished, of course.
Thank you, Urszula. Thank you, Patricia, Enrique, for the report on the three groups. Now we move to the Slido, Patricia, to inquire of your feedback on the day.
Yes, thanks, Pascal. So and thanks again, everybody, that you're still being here with us, and for sure we want to hear from you. We have put in the chat the link to access the survey that very briefly that we have prepared, and that you can also scan with your phone as we did before. There are just like a few questions on how did you find the overall setting. So if it allows you to exchange with others enough. Also, if whether you got to learn from other initiatives. There is a few questions, and most importantly, at the end you will see an open box, and there we will welcome also other suggestions. We are of course aware that this is a very multifaceted theme, and we try to cover the aspect of enhancing access to health services in rural areas that were more of most interest from everybody. Of course, there are many others. So just please, I will put the link again, and it will be opened during the next hours. So please just go there and let us know. And I think we can stop here for the time being, and I give you the floor, Enrique, since you are going to tell us a bit very briefly of what are the next steps for the side of the Rural Pact.
Very good. Sorry, it's been ages that we used this tool, and I was not finding the share screen function. I did now. Very good. So, but in the Rural Pact, so we have organized this good practice webinar. What's in it for you afterwards? So we are gonna upload all the presentations and rich material that we have shared today. They will all be available on the event page. You all have access to that page, or colleagues can put it there. We will anyway send you an email when the presentations and also the recordings, which hopefully would be ready in the next week, would be available. The presentations would be available early on. In the email we will send you, we will also share a list of participants in case you want to contact someone that you met today and would like to get to know more or interact for whatever reason. And we are also going to prepare a short highlight report with the main points and to give access to the material that we have shared as well today. And again, you will receive an email when this highlights report is published. Also, we would like to encourage you to become a member of the Rural Pact community platform. This is an online platform that would allow you as well, where we want to build a very broad community. It's an online space where you will be able to find peers. It has a lot of as well functionalities. There would be as well, we will try to develop good practices on the topic that we have addressed today. And so we want to make it a space where you can benefit from networking and colleagues. You could see that we have one functionality there about which we call the community groups. These are communities that are created by civil society organizations and institutions that they decide to bring a community there for exchanging, for sharing information, and to give more visibility to the specific topics within the context of the Rural Pact. So you can see in the website that we have created different ones, focus on specific themes like women in rural areas, mountain areas, etc. So probably you can benefit from some of them. And of course, it is open for all the members of the Rural Pact to suggest and that wants to lead and create and coordinate a group to come to us, make a proposal. The information is as well on the website how to create one of these groups. Make a proposal, and our role is to enable that the technical development so that it is created there. As I said, all the information it's on the website in case some of you are interested to lead and create a group on health. What you can find there, as I said, the group, you can contribute to discussions, you can create your own group, you can find peers, and you can as well suggest to us good practices so that we turn them and develop, put them in the platform so that other colleagues can access them. Here you have a snapshot of what the existing community groups are. When you become a member, you are able to join this group, so it's exclusively available for the members of the platform. Becoming a member is something really easy. You also register online, and all the information is in the platform. It takes 2 minutes to become a member. And in terms of upcoming events this year, I mean, we are concluding 2023. We have our last event on the 14th of December in 2 weeks. And it would focus very much on EU funding paving the way to rural vision. So we want to discuss issues around improving access to funding of local actors so that they can finance and support their initiatives, and about frameworks to enhance as well the support to rural development initiatives, very much linked with EU funding. The registration is closed for this event. It's what we call Policy Lab, so it's a bit different to the context that we have discussed here, which was more about sharing practices on the ground. This one focuses much more on policies, and we are working at the moment to design the work program for 2024, where we will organize a number as well of good practice webinars. We will also implement policy action labs, and more importantly as well, and important information for you to know, we are organizing as well a big conference next year, most likely in the second part of the year, with more than initially 400 people or around 400 people. And the idea is to make that conference really to fit the needs and the ambitions of the members of the Rural Pact. Okay, so it's still the agenda is quite open to decide what are the type of sessions that we are going to have there, and we will try to design it based on the input from the Rural Pact community. So if you are interested, please come back to us and let us know whether this could be something in which we can work together as well.
Thank you very much, Enrique, for this presentation of the next steps. I invite the participants, if you want to add in the chat any information, next steps of your organization or events that you would like to promote. So do not hesitate to put any information that we can, I would say, promote through our platform or to be in touch with. We are coming to the closing session now. I mean, it's not more a session, it's closing words. And I would invite Betty Ann from OECD, Chris Brown from WHO, John Wynne-Jones from EURIPA to make a closing word. And then I will give the floor to Alexia Ruby from DG Agri for the final words. And I think that Patricia, you will close the event afterwards. So, Betty Ann.
Yeah, sure. I'll be. Hi.
It's quite short because
no, it's pretty quick.
But we are welcoming your closing words to all of you.
Really briefly, I appreciate the opportunity to listen, and some of the things that stood out to me were in line with the work we hear. We're hearing a lot about I work exclusively on rural development, so the issue of health comes up a lot as a barrier. Access to health, to attracting people, how to make our regions or rural areas more attractive means better healthcare, health services is a pillar within that as well. So for me, this idea of integrated, this idea of bringing ministries like what I work with all the time to the table to help think about the issues that we're hearing, rising inequalities, population decline, shrinking resources, and how to maximize and build on and make rural areas more attractive means by definition how to bring in more health services. So looking forward to more engagement on these issues and more opportunities to bring different actors to the table. We do appreciate definitely hearing about examples and would encourage maybe a wider spate of examples, maybe even a publication where we can share this within the EU, but also with OECD member countries. Thank you.
Thank you very much. I pass the floor to Chris for a closing word as well. Are you still around? Patricia, I don't know if Chris is still around. I do not see, but if it's not the case, I will ask John, and in case Chris is coming back, I will pass the floor to Chris.
Yes,
John.
Okay, look, it's taken 26 years to get here. I'm incredibly encouraged by what I've heard today, so well done, everybody. I think we have a moral obligation to meet the World Health Organization's definition of social accountability, and I would encourage people to think about that. Please listen to professional groups that are involved. We've talked a lot about doctors, but this is about all health workers. Mustn't forget, it's about nurses, it's about physiotherapists, it's about pharmacists. So please see it in the spirit of Alma Ata and also the Astana Declaration. There's very little I've heard today that isn't in our blueprint. So my last message to you is please go and look at the blueprint. It's really worthwhile. I think it's a good document, and we'd be very happy to work with you to build that blueprint and that document further. So thank you ever so much.
Thank you very much, John, and we will disseminate this information together with all the presentations. And Alexia Ruby from DG Agri, you have the floor for the last concluding remark.
Thank you, Pascal, but I wonder if Chris is not here, if Theodora would like to say a closing word for the WHO.
Sure.
Not forcing it, Theodora, but if you want.
Yes, no, thank you so much. Yeah, Chris just wrote and she said she had an emergency come up, so she had to jump out. But just to say on behalf of WHO, we really look forward to continuing to work with all of you on key areas such as rural proofing for health, such as strengthening the health workforce in rural and remote areas, digital health, primary healthcare strengthening. I think that what Betty Ann said earlier about a collection of case studies, that could be very useful for us globally, learning from the countries represented here, but also sharing from other parts of the world, and then sharing what your examples are, your case studies with the other parts of the world. So we'd be keen to continue this collaboration, and we really thank you for including health so strongly in the Rural Pact.
Thank you for your nice words. Yes, Alexia.
Thank you very much. Well, it's been a very enriching webinar. We knew it was going to be, but it's been even beyond expectations. So I've picked up a lot of things that echo with the rural development issues in general. I sympathize with the 26 years. I think I've been around the rural discussion for 15, and so we can see it's not always going as quickly as we would want. But with the vision and Pact, we're really trying to push the momentum for this. I've picked up things around change of culture, change of perceptions of rural lives that applies across the board. Picked up that it's about promoting careers and not only the lifestyle you can have. Issues around decentralization, of training, of research, of service provision, digital divide, integrated governance, the importance of living conditions, the interplay between health and attractiveness of it both ways, and really the implications of health for local development, which is really something that I think we could, which is the argument that may work on national ministries, and we need to argue and push. So thanks so much to everybody involved. Thanks so much to the Rural Pact Support Office for great organization. Patricia, bravo. It's been a really a nice experience. Thanks a lot to Eureka. We were so lucky to and to have you you are the bridge between the rural policy and the health policy. So it's been really nice to be able to work with you, and we hope the Pact can bring some results to the work you've been trying to do for 26 years as well. Thank you to WHO for all the work you do on rural health. That's very precious. Always nice to be many rural fans and working in the same directions as much as possible. Same for Betty Ann in OECD. We were happy to have DG Santé also on board, because this is about this, right? It's about bringing all the different departments together, starting from the Commission. We're trying to do that job here, but also pushing the message to the member states. The Council of Europe, of the European Union, not the Council of Europe, Council of the European Union has adopted Council conclusions on the rural vision on 20 November. It's been a work of 2 years to obtain this, and so we're very happy that it happened, and health is mentioned in there, as well as the need for integrated holistic approaches. And this conclusion asked the member states of the EU to develop holistic rural strategies and action plans. So health should be part of this. There I will conclude. I think one of the things we really try to do in the Rural Pact is to build bridges between rural policies and policies in other domains like health today, and this has been a really successful experience. I think we just started. It's so broad. There's a lot to say, a lot to do. We covered a number of things, but it should be only the beginning, and let's continue the conversation after the webinar on what we can continue doing on this subject. So thanks a lot to everybody, and also to all the participants who took their time to be together with us for the whole morning. Thank you.